Visit licensuraexams.com and try our samples completely free of charge.
Greetings, my precocious therapists. Take a moment to breathe, relax, and get ready to join Licensure Exam on a deep dive into info you need to know. In the area Psychoanalytic therapy, understanding the intricate workings of your client's mind forms the cornerstone of effective therapeutic practice. When examining mental health disorders, therapists must first delve into the etiology, carefully considering how various factors interweave to create the present psychological landscape. Your client's experience of anxiety, depression, or other psychological conditions often emerges from a sophisticated interplay of genetic predispositions, environmental stressors, and formative experiences during critical developmental periods. These elements combine uniquely for each individual, creating distinct manifestations that require careful observation and analysis. The unconscious mind, a fundamental concept in psychoanalytic theory, serves as a vast repository of thoughts, memories, and experiences that, while not immediately accessible, profoundly influence your client's behavior and emotional responses. As you prepare for your licensing examination and develop your clinical practice, it's crucial to understand how these hidden psychological forces operate. When working with clients struggling with relationship difficulties, you might observe them unconsciously reenacting childhood patterns, perpetuating cycles that originated in their earliest interactions with caregivers. These repetitive patterns often stem from unresolved conflicts with parental figures, making their recognition and understanding essential for facilitating therapeutic progress. Defense mechanisms represent sophisticated psychological adaptations that your clients employ to navigate challenging realities and maintain their psychological equilibrium. In your therapeutic work, you'll encounter various manifestations of these mechanisms. Beyond common examples like repression and projection, you might observe sublimation, where clients channel difficult emotions into socially acceptable pursuits, or reaction formation, where they express feelings opposite to their true emotions. Understanding these complex defensive structures allows you to guide clients toward more adaptive coping strategies while respecting the protective function these mechanisms have served. Transference phenomena in the therapeutic relationship deserve particular attention in your practice. When clients project feelings and expectations derived from significant past relationships onto you as their therapist, it creates both challenges and opportunities for therapeutic intervention. A client who experienced emotional neglect might respond to brief therapy breaks with intense abandonment fears, while another who faced harsh criticism in childhood might interpret your therapeutic observations as attacks. These transference reactions, while potentially challenging to navigate, provide valuable windows into your client's internal worlds and relationship patterns. Remember that countertransference, your own emotional responses to clients, can serve as a valuable therapeutic tool for yourself when properly understood and managed. The application of psychoanalytic techniques requires both technical skill and emotional attunement. Free association, while seemingly straightforward, demands creating an environment where clients feel safe enough to lower their usual psychological defenses. As they speak without censorship, your role involves listening not only to the content, but also to the subtle patterns, omissions, and emotional undertones that reveal deeper psychological material. Pay particular attention to moments when the flow of association stops or suddenly shifts, as these often signal proximity to significant unconscious material. Dream analysis extends beyond simple symbol interpretation to understanding the unique personal meanings within each client's psychological landscape. Contemporary psychoanalytic approaches emphasize collaborating with clients to explore their dreams' significance, rather than imposing predetermined interpretations. When a client shares a recurring dream of being unprepared for an important presentation, this might reflect not only performance anxiety, but deeper concerns about authenticity, competence, or fear of judgment. The careful exploration of these themes often reveals connections to current life challenges and long-standing emotional patterns. Your therapeutic interpretations should emerge from a deep understanding of your client's personal history and present circumstances. Effective interpretation requires careful timing and attunement to your client's readiness to receive and integrate new insights. When working with a client who expresses persistent anger in their current relationships, you might gradually help them recognize how these patterns connect to early experiences of powerlessness or betrayal. This understanding can facilitate meaningful change in their present relationships and emotional responses. The therapeutic alliance remains the foundation upon which all other interventions rest. Building and maintaining this alliance requires consistent empathic attunement, authentic presence, and the ability to repair ruptures when they occur. Your genuine interest in understanding your client's experience, combined with professional boundaries and ethical awareness, creates the secure base from which exploration and growth become possible. This relationship serves as both the container and catalyst for therapeutic change. For your licensing examination and future practice, remember that psychoanalytic theory provides a rich framework for understanding human experience and suffering. The therapeutic process involves more than applying techniques. It requires integrating theoretical knowledge with clinical wisdom, personal awareness, and genuine human connection. As you develop your therapeutic style, these foundational concepts will help you create meaningful interventions that facilitate lasting psychological change in your clients. On your licensing exam, it's important to know what techniques are associated with psychoanalytic therapy and how they are applied. And remember, it's in there.